My name is John O'Broad and I work primarily for NHS England, and I work with a team in the Southwest region, which is the Integrated Personalised Care team. But over many years, I was actually a long-term conditions patient who always wanted to have his voice heard in whatever activity was happening for both myself, but also wanting to bring experience to the table when looking at strategic changes. Several years ago, I had a couple of issues that happened to me personally in my own personal care. And it wasn't until later on that I was told, oh, they were specific safety incidents or things that had gone wrong, where somebody had to talk to me about duty of candor and how safety could be improved. And I never like to go at the negative, so I don't like to take those as complaints or as issues. But what I do want to do is learn from them myself so that they don't happen to me again personally. And then I got involved with a wonderful organisation in Southwest called the Southwest Academic Health Science Network. And as a patient, they invited me to be one of the very first people that they invited from the patient voice to train as a patient safety officer in doing the training from the IHI, the Institute of Healthcare Improvement. And I found that so wonderful, so engaging, that I suddenly understood that this whole language that people spoke around patient safety, that patients had no idea about, that you really can look at patient safety in a methodological way and improve it, not just for one, but for all. So I sort of jumped off of the bandwagon of I want to improve things for me and onto the bandwagon of I want to improve things for everybody. And I actually believe that one of the best things we could do for patients, and especially those who want to have their voice heard, is to invite them as part of teams when we take our staff through into patient safety training. We really should have the patient voice with us as part of the team. There are an awful lot of people who want to have their voice heard and wish to be volunteers, wish to work with us in partnership. But it's about the equity and the way in which we hear that voice, and that all parts of a patient's journey should be heard, not just the little piece around what we're thinking of. Personally, I find the most fulfilling part of my job is working with professionals, working with staff, to just realize that by listening to, speaking with, and opening the door to having the patient voice, they can actually see things from a completely different point of view. And it's not until you get everyone around the table that you have the whole view of what it is that you're trying to improve or what you're trying to look at. So my absolute love is working on quality improvement, working with teams to understand the methodology, to get down to what the nitty-gritty of what they are doing is in patient safety, and then seeing the improvements that they make. And it's almost like a proud dad standing back and going, and now you got it, and now you're moving on your own. And that's amazing. That's a great thing when teams just go on to do great work as across this entire NHS and across the whole of health and social care. Great work is being done, but somebody has to be there at the start to trigger that and to help that. And my bit of that is to really encourage people to listen to the voice of patients and have that involved. And also to do that from a very personalized point of view. Every patient has a different story. Every patient has a different journey. And as we look forward, we have to be doing everything in a very personalized way. So taking those two elements together, the element of being able to teach a methodology that really works, and the element of listening to the patient and doing individual personalized care for those patients, and doing it in a safe and reliable way, that's just a magic combination. Things that were a difficulty before COVID are still a difficulty. Workforce. I mean, just this week, 23% of staff are off sick with COVID in my local hospital trust. That's an amazing figure that we would never have seen before, knowing also that that same hospital trust has a 10% or 12% rate of non-occupied job roles. You add that together, that's a massive shortage of staff. And It's in all areas, all the way through, from porters, cleaners, X-ray, nursing staff, clinicians, senior consultant posts, all unable to be filled, and the backlog that we have from COVID, and an understandable backlog. But equally, how do you get to deliver probably 20 or 30% higher rates of delivery than pre-COVID in order to catch up that backlog and do it in a safe and reliable way? We had safety issues when we were trying to cram in this work before. We've had safety issues every time we were asked to do more. So how do we prevent those safety issues re-recurring when we already know there's an issue with both capacity and ability? I wish we'd stop saying we can all get it right tomorrow, because actually, when you take into account everything that we've already said, in order to get a workforce to the place and the numbers that you want them to be at, and in order to give them the appropriate skills, takes years. And we have to acknowledge that. We have to say, hey, look, guys, we didn't get it right. Yes, we cut numbers. Yes, we did all sorts of things that got us to the position that we're in. And then a pandemic hit. And we're not going to solve it tomorrow. So please, please stop saying it will all be all right tomorrow, because it won't. It will take us time. But we now have to put the plans in place now to think 5 years down the road, how many people do we want in post? Where do we want them? What are the job skills? What is the mix? What are the changes that we need to make to the workforce now? And let's take the public with us. Currently, I'm so sad when I hear that members of the public are being rude to our staff because of the situation where they're not being able to get access to the care that they want. That's just a terrible thing for our staff to go for. Equally, it's an awful thing that people aren't being given the correct messages that, guys, I'm really sorry, you're just going to have to wait for this, but we'll help you to wait in a way that is beneficial to you. So yeah, there's lots of things we could do, but the one thing I'd ask is, let's get our workforce into the right place. Let's look after our staff. Let's stop blaming them for things that are going wrong, when actually it is process and system that is the issue. And let's commit to them to give them the resource and the allocations that they need. I was proud about having had the opportunity to actually write part of the patient safety strategy. The biggest thing that we need to do is resource that strategy appropriately. I've said this before at a conference, and I'll say this again here. If I had known that there was going to be zero resourcing given to the National Patient Safety Strategy, I would not have put my name to it. It was intended that when we asked organisations to take on patient specialists, patient leaders to help them with patient safety, that would be resourced appropriately. It hasn't been. Organisations have been told, you've got to find the money from within your own resource. That's wrong. We must ensure that we give the resource to make safety happen, and we're not currently doing that. If I could change one thing and make it permanent, I would ask this one simple thing. If you're a manager, please go and see your staff. Talk to them, listen to them, ask them what's happening on the shop floor, and make changes that they want. Give them the love, the care that we need to give to our patients. If we don't look after ourselves, how can we look after others? So for me, it would be very simple. Get out of your offices, talk to those that are doing the day job, talk to the patients in the bed, talk to the patients in the community, listen to what is actually happening, not what is perceived to be happening from the boardroom, and act on what you hear, and be compassionate and caring for your staff in the same way that you'd expect them to be caring and compassionate to your patients. So outside of work, most people would know me as a bit of a geek. I love music. I love sci-fi. And I often will quote the odd sci-fi movie. You know, The Force is with you as an example. To this extent, I actually proposed to my lovely lady wife on the 4th of May so that I would actually remember what day it was that I proposed to her. So yes, may the 4th be with you, and I hope that you enjoy laughing at that. I like to often say that the NHS is so far for me on a balanced playing field. And I say that because so far you've managed to kill me 3 times, unfortunately through drug allergies. And I have had 3 arrests and therefore maybe have been technically dead. But equally, you're doing all right because you've actually revived me 3 times, as hence being here. So 3 for 3. Let's leave it at that. Thank you very much.